Republicans are the party that are fixing healthcare. We're fixing healthcare. Obamacare is what broke it.
Healthcare reform is going to be a big part of the agenda. When I say we're going to have a very aggressive first 100 days agenda, we got a lot of things still on the table.
No Obamacare?
No Obamacare. Yeah, the ACA is so deeply ingrained. We need massive reform to make this work, and we got a lot of ideas on how to do that.
I don't know if it bothers you the same way that it bothers me. And it bothers, I think, a lot of people that really pay attention to politics, how like the ACA gets used to reference it in some cases, Obamacare in others. You're in favor of upholding, but perhaps refining the law in one case, and then it turns out, nope, so you've actually got nothing, because like he talked there about an aggressive 100 days, and I know that we're through the 100 days. You know how I know that we're through the 100 days? Because actually I counted them off. We're through a couple 100 days, and you all know how much better healthcare is now than it was before all of that. Although, to be fair, sarcasm aside, they did do some reforms. After all, they cut like $1 trillion from Medicaid. That's a form of reform, I suppose. And now they're doing some more with the shutdown continuing, and one of the major negotiating sticking points being the continuation of these Obamacare subsidies. If they allow those to lapse, that would be reform, I suppose. Not necessarily the reform that they ran on or that most Americans would want, but it's a significant one. And understand, as we roll into this and we talk about the negotiating going back and forth between the Republicans in Congress on the one side and the Democrats that are pushing for these subsidies to be continued on the other side, 1/3 of Americans don't appear to know Obamacare and the ACA are the same thing. And like, it's been around for a really long time. Come on, America. What are you doing with yourself at this point? Like, you've had time. I'm not expecting that you should have known on day one, and every day new people enter into paying attention to politics that didn't used to, but you should know it at this point. But anyway, we're now 2 weeks, I think this is the 14th or 15th day of the shutdown. And here is how Mike Johnson is talking about the major sticking points, which I believe have been very clear, not only able to be articulated, but in fact have been articulated from before the shutdown even began. That said, he doesn't seem to know what's going on, saying the COVID era Obamacare subsidy that they're all talking about, that's supposedly the issue of the day, supposedly, doesn't expire until the end of December. And by the way, it is the Democrats who created that subsidy, who put the expiration date on it. They put an end date on it because they knew it was supposed to be related to COVID, and it's become a boondoggle. When you subsidize the healthcare system and you pay insurance companies more, the prices increase. Maybe you guys could come up with a plan some decade, because you've been talking about your issues with Obamacare since before it was even passed. And you guys haven't come up with a goddamn thing.